Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And today we're going to talk about a very important subject area, and it's going to relate to breast cancer and the diseases that are inherent with women and particularly breast issues. So let me introduce our stars. We have two stars here. We have Mary Hayes, Dr. Mary Hayes, I apologize, Dr. Mary Hayes, who's the medical director of the Women's Imaging Center for Women's Imaging, because you have multiple centers, for Memorial Health System. Welcome.
Thank you so much.
Good to have you here.
It's a pleasure to be here.
And Tejal Patel. Dr. Tejal Patel is a medical oncologist slash breast oncologist at Memorial Breast Center, Cancer Center, which is located where?
In Hollywood, Florida.
In Hollywood, at
Yes.
Memorial Regional?
Regional, that's right. That's
okay.
right.
Breast cancer is a very common disease, and it does affect 1 in 8 U.S. women at some point during their life. So our goal is to detect this breast cancer early, at its earliest possible stage when it's most treatable. And our second goal is to try to decrease the false alarms that women have when they do have mammography, in order to reduce the anxiety that's associated with getting a mammogram. So at Memorial Healthcare System, we use state-of-the-art, all digital mammographic technology. We have about 16 units in our system at 4 women's imaging sites. And what's very exciting is we've conducted some research in conjunction with Mass General Hospital, the Harvard institutions, and we were one of multiple sites that participated in the research. And we've seen this come through gestation, and now it just got FDA approved in February of 2011. And this latest technology builds on the foundation of digital mammography, and it's called digital tomosynthesis mammography.
All right.
And to a patient, it looks and feels like a regular mammogram. But to the radiologist, the imaging specialist physician that's reading the mammogram, it's quite different. And what it looks like to the radiologist is, instead of reading just a flat 2D image, just like we take a picture with our camera, that's a flat 2D image. Instead, the tomosynthesis acquires 15 mini low-dose images of the breast, same radiation dose as if you got a 2D. But we're able to page through the breast literally millimeter by millimeter. So the difference is reading the cover of a book versus reading the content of each page in a book millimeter by millimeter. And the studies that have been produced and FDA approval was based on shows that we can decrease those false alarms to patients by 30% and increase the lesion detection, finding those small lesions when they're most treatable, by 15%.
I think a lot of the fear questions, and I will tell you, the number one fear issue that is presented to us by our viewers is this word cancer.
You know, having a diagnosis of cancer, any cancer, you know, breast cancer, of course, is life-altering at times, but it's up to the women themselves to decide where to go from here. They have to understand that they're not alone. There are thousands of women that get diagnosed every year, and we have tremendous amount of research, researchers working on two most important things. One is, of course, to diagnose it early, to find a cure, and the second thing, which I think is also very important, is to improve the quality of life and the toxicity of the treatment. And in the past 10 years, there has been a tremendous influx of targeted therapies which have helped improve the survival of the breast cancer patients, as well as increase the cure rate. We at Memorial Breast Cancer Institute, we have a multidisciplinary team where we have breast medical oncologists. There's 5 of us that see breast cancer or breast-related disease all day. We also have breast radiologists that start the process. We have breast surgeons that do the surgeries. We also have breast pathologists. Sandy Barnick is one of our pathologists that is specialized in breast. We also have breast radiation oncologists, and we have a unparalleled support with plastic surgery.
I really appreciate it. Thank you from my viewers to you. Thank you very much. Remember, there's an opportunity to better your life and to better the care of your body. So take advantage. See these folks, see the people, your primary care physicians. Make sure that you have your mammographies and you have your pap smears and you have whatever is necessary. Anyway, thank you very much for viewing us again this week. Remember, this is your show. It's called Dateline Health. We come to you from Nova Southeastern University. If you have any questions, there's a telephone number, there's a web address. We're going to put up the address of your center to make sure that people know where you're at. And I want to thank you once again for viewing us this week. Remember, take good care of yourself. My name is Fred Lippman. Until next time, see you.